from the Faculty of Health with a thesis titled Reducing Hospital Admissions Among Preschool-aged Children with Recurrent Wheezing Illness. Would you please welcome Dr. Jessica Costa-Pinto.
As a mum, I see my kids most happy when they're healthy, playing outside, socialising with friends and family, and learning through exploration. In my work as a paediatrician, I also see children who are unwell in hospital, many of whom are coming in for the second, third, or even 10th time. You can imagine that for these kids and their families, coming to hospital causes a lot of distress and disruption to their lives. Wheeze episodes, sometimes referred to as asthma, cause children to have difficulty breathing, and 80 to 90% of these episodes are triggered by viral infections. Kids get sick with viruses all the time, but for children with wheeze, this can mean many trips to hospital every year. Wheeze is the most common reason why preschool-aged children are admitted to hospital in Australia, placing strain on our healthcare system and costing over $130 million every year. Unfortunately, the treatments that we have available are not effective at keeping preschool-aged children out of hospital. But what if we could change this? We know that children who grow up exposed to environments rich in bacteria when they're young, like a farm with animals, are less likely to develop wheezing illnesses and asthma. OM85 is an oral medication that contains broken down bacteria to promote a healthy immune system. It helps kids fight the viruses that trigger wheezing episodes and reduces the inflammation in the airways. Taking OM85 is a bit like having the benefits of growing up on a farm. OM85 has been used overseas for over 3 decades to treat viral illnesses, and we know that it's safe, but we don't have large studies confirming whether it's effective at reducing wheeze episodes and hospital admissions in children. For my PhD, I aim to determine whether OM85 reduces hospital admissions in preschool-aged children with wheeze when compared to placebo. To answer this important question, I will be coordinating a large NHMRC-funded trial of nearly 2,300 children referred from over 40 hospital sites across Australia and New Zealand. This trial is being conducted through the Children's Inpatient Research Collaboration of Australia and New Zealand. My PhD has the potential to completely change the way we treat preschool wheeze, not just in Australasia, but throughout the world. My research could improve the lives of kids with wheeze and their families by keeping them out of hospital.